Lucci, some 400 million people worldwide are affected by heart disease and diabetes. And today we're talking about the many ways to take care of our organs and specifically our heart organ.
Yeah, we need to. Here to tell us what we can do to control certain risk factors is Dr. Abraham Thomas from Baystate Medical Center. Doctor, good to have you.
Thank you for having me on.
So you're continuing Baystate's Heart Health Lectures this month. So what are you focusing on in particular this week?
So as you mentioned, 400 million people worldwide have diabetes, but in the United States, 25 million have diabetes and 75 million have pre-diabetes.
Wow.
And many of those people will die because of heart disease. And we're able to reduce their risk of dying and the complications by managing their diabetes.
How often do people with diabetes have heart disease?
It's probably the most common reason why people die sooner than their life expectancy. It's from heart disease and stroke. And if you compare someone who's never had a heart attack to someone who has a heart attack, if you had a heart attack, you're more likely to have another heart attack. But someone without diabetes is at the same risk as someone who's had a heart attack before.
Wow. Now, not to overstate the obvious, but there is a link between diabetes and then heart disease. What is that link? What is it about having diabetes that then makes you more prone to having a stroke or getting heart disease or something?
There's lots of factors, but many people with diabetes, if their glucose is elevated, it can damage their blood vessels. Many people with diabetes have high blood pressure, which also contributes to heart disease and stroke. And they also can have elevated cholesterol or bad cholesterol patterns that would increase the risk. Some of that is related from obesity. Some of it's related also from the diabetes. Now
that we got the good news out of the way, joking there, we can take control of the situation. I guess that's the point of your talk. We're not just victims to this. As a diabetic or pre-diabetic, there are things you can do to alleviate or at least reduce your chances of getting heart disease.
So we can focus on controlling the glucose, and we have many more medications to control glucose than we ever had before. And two classes of medications recently, in the last few years, were shown to reduce the risk of heart disease and death. So that's brand new.
Wow.
For decades, we've never had anything that did that. And we control the blood pressure, that's effective, and really controlling cholesterol. If we smoke, smoking is such an awful thing to do in general, but with diabetes, it magnifies the problems. So if we can stop smoking. And then, of course, it's essential to have lifestyle changes. So losing weight, exercising, following a healthy diet.
And there are two types of diabetes. Are we talking about both type 1 and type 2 that deal with us?
So both people with type 1 diabetes, which is where there's not enough insulin made due to an autoimmune disease, and type 2 diabetes, which tends to be as people get older and their pancreas fails and they're insulin resistant, both of them are affected by increasing ability to have heart disease. We
covered a lot of ground. There's a lot of information. We're running out of time, but Dr. Thomas, when is your lecture this Sunday?
So the lecture is at Sunday at 361 Whitney, and we'll have an hour to give a talk and then time for questions and answers.
Fantastic. This is free, open to the public?
Yes, it is.
All right. Good to know. Thank you so much.
Thanks for your time.
Thank you.